Okay, welcome to tonight's webinar. My name is Allie Armstrong. I'm a field marketing specialist for Axonics Therapy and will be moderating this webinar. Your video and audio have been disabled, so we cannot see or hear you. If you have any questions for Dr. Taghechian throughout the webinar, please feel free to type them in the chat feature located at the top or bottom of your screen. I will direct the questions to Dr. Taghechian during the Q&A session at the end. Please note all questions will remain anonymous. We are only able to answer general questions and are not able to utilize this setting to diagnose your condition. Towards the end of the presentation, you will see a poll on your screen. Please answer the 3 questions. This will help us understand how the event benefited you and help us on ways to improve. This evening, Dr. Taghechian will be speaking about bladder dysfunction, the common symptoms patients experience, and treatment options that may help you gain control. Without further ado, I would like to introduce Dr. Taghechian.
Hi guys, it's Dr. Taghechian. Thank you for joining us this evening. I probably have some of you as patients, and I'm glad you're here. So tonight we're going to talk specifically about stress incontinence. Incontinence is just a fancy word for leakage, and people can have different reasons to have leakage. Stress incontinence specifically is when one leaks with movement or activity, such as sneezing, exercising, laughing, coughing, walking. So we're going to specifically focus on stress incontinence tonight. So before we talk about the problem, let's talk about how a normal bladder is supposed to function. Well, first of all, your bladder is supposed to store a decent amount of urine, about 16 ounces. So the bladder is nice and relaxed and it fills up with urine. And as it's filling up, the urethra, which is the tube that we pee out of, is contracted and closed. When we want to urinate, on the other hand, a coordinated set of actions has to occur. Number one, the bladder needs to squeeze or contract to let the urine start flowing, but also the urethra needs to relax. The pelvic muscles need to relax and open the door so that that urine flows out. But what goes awry when somebody has stress incontinence? So the issue is an anatomic issue. So either the urethral sphincter muscle is too weak, or the urethra itself is floppy and not well supported, like from childbirth or frankly just getting older, chronic constipation, things like that. So what happens when you sneeze, cough, exercise, that increased abdominal pressure from those activities basically overwhelms the urethra and urine escapes. And we call this stress incontinence. You are not alone suffering with this problem. Over 1/3 of women at some point in their lives suffer from stress incontinence. So it's a very common ailment. And unfortunately, it can really impact one's life, not in great ways, usually in bad ways. So many patients end up suffering from depression, low self-esteem, anxiety. The leakage itself or sitting in that wetness can cause skin problems. Certainly the risk of urinary tract infections goes up. And then the leakage can be unwelcomed. For example, you could be sitting in a meeting and you have an unfortunately timed sneeze, and there you go, the meeting's cut short. And also a lot of women suffer from embarrassment. And so they avoid intimacy with their partners, or they don't spend as much time interacting with their family and friends. And of course, there's the economic impact. So much money is spent on pads, diapers, laundry, so not good. But the good news is that there are treatments that can help. And everybody's treatment journey is going to be different. Things like how bad your stress incontinence is, how old you are, if you have other medical issues. All these can impact where we start with your treatment options. And the other thing is, it may take more than one way or more than one angle to achieve the best results. So maybe that we need a combination of these things to get you to stop having stress incontinence. So lifestyle changes can help. So things like maintaining your weight in a normal range so that you don't have that increased abdominal pressure on the bladder from the get-go. Quitting smoking helps. Trying to control chronic coughs, like for patients who have, COPD, asthma, things like that. If you can get those under control, then certainly that helps the amount of leakage that you have. Also, pelvic floor exercises. These are, I think, really, unfortunately, underutilized, but pelvic floor exercises can help to strengthen that pelvic floor, and it can compensate for the weak urethral sphincter. And I love referring my patients to pelvic floor physical therapists. These are physical therapists that only deal with the pelvis, the pelvic floor, the bladder, and essentially they ensure that you're doing the exercises correctly. Believe it or not, most of us really don't know how to do a Kegel correctly. I probably couldn't even do it correctly, but with the help of a pelvic floor physical therapist, they can get you there. The gold standard for treating stress incontinence is placement of a sling, a synthetic sling under the urethra. And this sling helps to support that floppy urethra, and it helps to compress the urethra. So there's more resistance against leakage. A very high success rate comes with this surgery, but it is a surgery. It's outpatient. It requires a good 4 to 6 weeks of recovery. And frankly, just as with any other surgery, there are risks associated with it. And specifically for this, there could be temporary or long-term risk of urinary retention where you can't urinate maybe for a short time or potentially a long time, and you might have to self-catheterize to empty your bladder. Sometimes you need a second surgery to sort of correct this issue. There's also a small risk of bladder or other organ injury during the placement of the sling. And very rarely, but sometimes you can see women that suffer from or they develop long-term pelvic pain. But now we also have another option, which I'm super excited about. There's urethral bulking available with an agent called Bulkamid. So this is a quick 10-minute procedure. It's usually done in the office or in our procedure area. And under some local anesthesia, so shots of like lidocaine around the urethra, and with the help of some laughing gas, what we do is we inject this Bulkamid substance into the walls of the urethra, the tube that you pee out of, to bulk up the walls. And again, this also provides more resistance against leakage. And so in 10 minutes, you're up and walking out the door with essentially no restrictions, other than maybe no sexual activity for a week or so, but you've stopped leaking in 10 minutes. So what is Bulkamid? Well, the concept of urethral bulking is not a new concept in the world of urology, but in the past, the materials that we've had to be able to bulk up the urethra, they've been less than impressive. And they've essentially had minimal to no improvement in symptoms in those patients. Either as surgeons, we had a hard time injecting the material where we wanted it, or the material would disappear quickly and we would have to keep re-injecting the patient over and over again. So we never really offered urethral bulking as a viable option for stress incontinence because we knew that it just didn't work very well. That is until now. So Bulkamid is a substance that's soft, It's gel-like, and it doesn't move or migrate. It stays put where we inject it. It's made of 97% water and 3% this amide backbone that essentially helps to keep the water in place. And because our bodies are mostly made up of water, we just keep recycling the water in this substance, and that's how Bulkamid stays put and doesn't disappear. So interestingly, in Europe, mesh is, so a sling essentially, is completely off the market, and nobody, no physician can use mesh for any type of vaginal surgery. Obviously, it's a little bit different here in America because we still use mesh, as I just said a little while ago. So for the past 8-9 years in Europe, they've been using this Bulkamid. And for those women who got injected with Bulkamid, starting 8 years ago, those women are still doing well. They're still not leaking, and they still haven't had to have a re-injection. So we know that at the very least, it'll last for 8 years and probably even longer. I've been using Bulkamid in my patients for the last 2 years when it was available here in this country, and both my patients and I are extremely happy with the outcomes. And ultimately, the number of slings that I've done in the last couple of years has decreased significantly since Bulkamid has been available to me. I just don't need to do slings that often anymore. So that's awesome. Oh, sorry. I think there's a little video here. Except I don't know how to do it. Allie, any suggestions on how to start this video?
It should just start automatically.
It doesn't look like it really wants to.
Oh, weird.
Well, it's okay. I'm essentially going to tell you what the video says anyway. It just shows how the procedure is done. So here you can see the bladder. You can see the tube that you pee out of. So what happens during this procedure is I basically would go in with a little cystoscope or a little camera into this tube that you pee out of. Again, remember, everything is numbed. You don't feel anything. You're breathing in that gas. And this is a cross section of the urethra. And what I do is I inject this Bulkamid into about 4 different places to provide this nice cushion. And as you can see, the lumen of the urethra is nice and compressed. So there's more resistance against leakage. And so that's how it works. This is a safe and effective material. 92% of women are cured or improved following treatment with Bulkamid. It's simple. It takes 3 to 4 small injections, and in 10 to 15 minutes under local anesthesia, you're done. And thus far, it has really shown some long-lasting relief up until about 8 years at least now. So if you are ready to discuss this, then you can take the next step. And certainly feel free to reach out, make an appointment. There's our phone number for Georgia Urology, or you can scan the QR code, fancy technology, and we can get you in to see us, and we can talk about Bulkamid.
Yeah.
Thanks for your time, everybody.
Thank you, Dr. Taghechian. It was a pleasure hearing from you and your experience with treating patients suffering from these conditions. You will now see a poll feature pop up on your screen. Please answer these 3 questions. This will help us understand how the event benefited you and help us on ways to improve. Thank you for answering the survey. At this time, we are going to open up the Q&A session. If you have any questions for Dr. Taghechian, please type in your questions in the chat feature located at the top or bottom of your screen. Your questions will remain anonymous. Okay, what percentage of your patients have needed further attention after this procedure?
That's a great question. I think over the last 2 years, honestly, it may have been 0, potentially 1, but no more than 1. And I've done lots of these. So very, very, very low percentage.
Is there a certain age restriction?
Nope, not at all. All comers are welcome. For things like slings, we don't like to place slings in women who are not done having children, because obviously in the process of childbirth, lots of things change in the pelvis and in the vaginal area. So, it's a moot point putting in a sling at that time. But for Bulkamid, it's a completely different procedure. So at any stage, at any point in your life, it's okay to have Bulkamid.
And what did you say the other 3% was made of?
So it's this amide backbone. Like, I'm not a chemist, but it's this amide backbone that essentially just draws water to it.
Is this procedure done on certain days at your clinic?
It's done whenever I am in our procedure area, and those sort of vary, but I'm usually in our procedure area maybe Tuesdays or occasionally some Thursdays. So it's just done when I'm available to do it.
Okay, this one kind of goes with that. Is this always done in your office?
So ideally, yes, it would be awesome if we could do it in our procedure area because, like I said, you're in and out in like 10 minutes. Now, occasionally, I'll be honest, there are some insurance companies that aren't covering it necessarily in our procedure area. And I've had to take some patients to an actual operating room for still this little 10-minute procedure, which is okay, but it really sort of eats up half your day. But most of the patients, and as we do Bulkamid longer and longer and longer, they're being done in our little procedure area. So it's not quite as big of a show to get it done.
Will it cause UTIs?
No, there should be no reason for it to cause UTIs.
You kind of touched on this, but do you have problems getting prior authorizations with insurance for Bulkamid?
It's getting better and better. I would say I'm meeting very little resistance at this point. So most people, if they want it, they're covered.
How do you differentiate between whether it's stress or overactive bladder or both?
It's based on the patient's symptoms. So when I ask questions and sort of get into the nitty-gritty of what's going on when you urinate, that tells me what's going on. So, stress incontinence, again, is specifically only leakage with some kind of activity like coughing, sneezing, exercising, picking up something heavy. So that specifically is stress incontinence. Something like overactive bladder is a different issue. Overactive bladder is basically defined by somebody who's going to the bathroom very frequently, like over 8 times during the course of the day, getting up at night multiple times to urinate, having extreme urge to urinate, and you just cannot hold off on that urge. And sort of at the end of that extreme of overactive bladder, you can have leakage of urine with that urgency to go. So that is called urge incontinence. So it's a different kind of leakage, and it's more of a bladder behavior issue. The bladder is sort of squeezing, spasming, giving you those overactive bladder symptoms and causing you to leak. And so we have to sort of address the bladder behavior and not so much the anatomy. So, not all leakage is caused from the same thing. And so in that process of, talking to the patient, I can sort of tease out what the issue is.
Okay, if you've had a previous consult for this issue, can it just be scheduled or is another consult needed?
That would have to go on a case-by-case basis. So I'd have to go back and look at the chart and see where we were. But yeah, potentially, yes, you could just schedule it.
How do you determine if this is preferable to the Botox bladder procedure?
So completely different, okay? Bulkamid is for stress incontinence. Again, we're providing resistance against leakage from that increased abdominal pressure. Botox is for those patients who have overactive bladder, urge incontinence. Again, it's the addressing the behavioral issue of the bladder. So Botox, basically, wherever we inject it, we're paralyzing those muscles. So when we inject Botox into the bladder, we are stopping those spasms from occurring. So Botox is not a treatment for stress incontinence, it's a treatment for overactive bladder and urge incontinence. And Bulkamid is a treatment for stress incontinence. So not the same at all.
We've gotten so many good questions tonight, so I've got a few more. Is this safe if you have a prolapse bladder?
Yeah, it is, as long as we know that you are able to empty well, which we usually do by checking post-void residuals in the office with a little bladder ultrasound. As long as you know you're emptying well, absolutely, you can do Bulkamid.
When can you go back to normal activity?
Immediately, except for I would avoid sexual activity for about a week. You don't want to go flattening those cushions as soon as you made them. So after about a week, you can resume sexual activity as well. Otherwise, everything else, you are back to normal as soon as you get off the table.
Can you have this procedure done if you've had a sling that didn't work?
Yes.
Must someone drive you and stay for the procedure?
Depends. So if you're having the procedure done like at our, procedure area at Georgia Urology, no, you don't. Again, we use local anesthesia and we use that laughing gas, something called Pronox. And what's really nice about that gas is that once you start breathing it, you feel it immediately. And once you stop breathing it because the procedure is done, it is out of your system in 5 minutes and you can drive yourself home. But if we have to do this, at an outpatient facility, at the hospital or what have you, that's a different story altogether. And you may get some light anesthesia there. And yes, somebody would have to drive you home from the hospital.
Are follow-up visits required?
Yeah, of course. I usually want to see you to see how you did. So I usually have you come about 3 weeks after, and we just sort of reassess and see how you're doing.
Can you have both stress incontinence and overactive bladder at different times?
You can have it at the same time. Yes, one does not preclude the other. So sometimes you have to treat a patient for multiple issues at the same time. It can be sort of complicated, but that's what we're here for.
How long will Bulkamid last?
So far, it's been lasting 8 years from those patients in Europe, and it's probably going to last longer.
I got another one. I'm sick of wearing pads all the time. I went through menopause, never pregnant. Why do I have bladder control issues? Is it because I've had a lot of UTIs?
No, UTIs don't lead to stress incontinence, but that's more of a complicated issue. You should definitely come in and see me because, there's different reasons to have the issues that you're having. We have to sort of tease out what's going on with you. It's multifactorial in women, especially postmenopausal women. Lots of things can lead to bladder behavior issues or stress incontinence, including, frankly, losing that vaginal estrogen. So you're a little bit more complicated. Come in and see me and we'll figure it out.
And one last one. Can I still have children after having Bulkamid?
Of course. It does not affect that in any way. It just keeps you from leaking with stress incontinence.
We're still getting them. This is a really questions bunch. I'm loving it. Someone just asked, do you have any patients that this did not work for?
I would say that everybody had improvement. Occasionally, we have to do what's called a bulk up or a top off procedure. I'm sorry. About 6 to 8 weeks later after your first one, just to make those cushions a little bit bigger, just to inject a little bit more, and that usually gets them the rest of the way there. Again, the success rate is pretty high. I would say the success rate in my hands are, and probably frankly in the general urology populace, is about 80%. So 80%, maybe even higher than that, 80 to 90% of people have improvement or cure. So there's still that 10, 15 that it doesn't do as much as they would like. And those are the patients that we can discuss a mid-urethral sling, for example. We do the other options that are available to us.
I swear, these are the last two. Are
Mhm.
results seen right away?
Yes.
And are there any risk associated with the procedure or substance used?
I don't think so. I mean, again, there's for every procedure that you do, there's always a risk of something, correct? I haven't seen anything bad happen so far, knock on wood, gotta find some wood. But, could you potentially like have some bleeding afterwards? Sure, it's usually not a lot. Could you potentially have a UTI afterwards, right afterwards? Potentially, I don't see that. There's a very low risk of not being able to urinate that same day, where we would have to sort of catheterize you to empty your bladder. That's not a very common occurrence. And if it does happen, it lasts less than 24 hours. It's never a long-term problem. Outside of that, I haven't seen any issues.
Okay, well, let that be the last one. If you have any, and that brings us to the end of this evening's webinar. Thank you, Dr. Taghechian, for your time. We hope the presentation was beneficial. If you have any questions or would like to schedule an appointment, we have several ways to help you do so. If you have already seen a provider at Georgia Urology, please feel free to contact your physician for further questions about the procedure or to schedule an appointment by using the QR code on the screen, calling the phone number, or visiting the Georgia Urology website. The easiest way by far to schedule an appointment is for you to use the QR code on the screen. The code can be read by the camera app on your cell phone. Here's how it's done. First, open your camera app just like you do when you take a picture. Point your camera at the code on the screen and get into focus. You should see a prompt. You should be brought directly to Dr. Taghechian's scheduling system. Now, in order to access immediately available appointments, you will want to go to the reason for your visit and type in webinar/mailer. Schedule the time that is most convenient for you, and you're done. If that way doesn't work, you can skip the shortcut and simply go to the Georgia Urology website. Finally, if you want to call for an appointment, that's fine too. The number to do so is also on the screen. Please follow the prompts, and when you speak to an operator, leave a message and simply let them know that you are attending this webinar so they can get you in promptly. Thank you guys for attending tonight.
Thanks, everybody. Have a good evening.
All right.
Bye.